Hi y'all, Dr. Ryan Edwards with Windermere Dental in Cumming, Georgia. Thanks for checking out my second video. This is going to be on good home remedies and bad home remedies. I promised I would make this video because I know a lot of us are stuck at home. I'm stuck at home myself. I am available for my patients of record to see urgent dental problems like infections, swellings, throbbing pain, severe trauma, things like that. I'm going to help you out with that. But along the way here, while we're all stuck at home, you may have some less urgent dental problems that you may start searching around on the internet for advice on how to deal with it. I want you to have good advice to deal with it because some of that stuff on the social media is not great. For those of you who are not patients of mine, you should check my credentials. I am a graduate of the University of Florida College of Dentistry, graduated 2001, and attended a residency program at the University of Alabama, Birmingham, from 2001 to 2002. I practice here in Cumming, Georgia. I'll put my website address down below. But you should, anytime you see information on social media, you should follow up on the source and make sure it's a actual credentialed person that's giving you that advice. Everybody really would do well for following that. All right, let's not waste too much time. Let's get to it. Good home remedies. Okay, good home remedy number one really is just prevention. You need to be brushing and flossing. I know you've probably heard that a million times, but brushing twice a day for a solid 2 minutes and flossing every day goes a long way towards keeping everything healthy. Mostly in this short period of time, 3 to 4 weeks, you're not going to get just a cavity in that short amount of time, but brushing and flossing goes a long way towards preventing gum inflammation and gum problems. Also, you want to, any of you who have any fillings or any crowns, any dental work at all, you need to be avoiding sticky things. No caramel, no taffy, no jelly beans. Do not tempt fate. If you have any dental stuff on your teeth, I would avoid sticky things. I would also avoid anything really hard or crunchy. No hard pretzels. Don't crunch on ice cubes. Don't crunch on hard candy. All of that stuff, you need to avoid it. Just play it safe. Don't tempt fate. Also, if you have a mouth guard, I would recommend using your mouth guard. It's like a helmet for your teeth. It's going to protect your teeth if you are a grinder or a clencher. During the daytime, try to keep in mind that you should have air between your teeth. You want your lips together, teeth apart. If you have your teeth together, you are clenching. And everyone's going to be going through a lot of stress during this time. So try to keep your lips together, teeth apart. If you have a lot of excess stress, go out and exercise. Burn off those steroids and those adrenaline compounds that are flooding your body from your stress. Get that stuff out of your system, exercise. On top of that, make sure you're getting good sleep at night. That goes a long way towards keeping your immune system healthy, lowering inflammation in your gums. Also, to keep your gums healthy, it's helpful to make sure you get lots of vitamin A, vitamin C, and vitamin E, and plenty of iron. All right, home remedy number two, if you lose a filling or if you lose a crown, I mentioned this in the previous video. You can get temporary filling material at the drugstore or off of Amazon.com. Mix that paste and it'll form like a little putty, and you can use that either to fill in the hole or to put your crown back on your tooth. If you can't find that and you have a crown that came off, you can also use a dab of toothpaste in there to put that crown back on your tooth. Might only last a day or two, but if you just do that every other day, it's going to get you by for a couple weeks until we can get you back in the office. Home remedy number three. If you have an ulcer or a cut in your gums or in your lip or your cheek, warm salt water rinse is great to take care of that. Mix 8 ounces of warm water and a teaspoon of salt. Does not taste fantastic, but it works really well to treat your gums or a cut in your cheek or your lip. If you have a burn, number 4 would be, again, you can use the warm salt water rinse, or you can use a vitamin E gel cap if you have a burn from hot coffee or hot pizza. You can actually get those vitamin E gel caps from the drugstore, cut them open, and you can actually rub that vitamin E gel very gently on the area, and that helps it feel a lot better. Recommendation number 5 would be if you have soreness or pain in your jaw joints or your muscles, really just warm, moist massage. Get a warm washcloth, or if you're in the shower, let the warm water run across that area and just gently massage that joint or those muscles, and that will help it make it feel a lot better. Finally, recommendation number 6. If you just have a tooth that's sore or anything else that's painful or sore, I have to say ibuprofen or acetaminophen. Those are the generics. You can figure out what the brand names are for those. But those were great for tooth pain, mild soreness, maybe you bit on something unusual, or maybe you were grinding your teeth a lot last night and your teeth are sore. Again, acetaminophen or ibuprofen are the way to go, and you can do that. All right, now for bad home remedies. All right, one I see happen, actually I don't see this quite so much anymore. I used to see it a lot more often. I think people may have learned their lesson on this one, but using aspirin directly on a tooth or directly on the gums. It's called topical application of aspirin. It's not good to do. Aspirin only works if it's in your bloodstream, so you actually have to swallow the aspirin for it to do what it's supposed to. People who are using aspirin in this way are trying to use it as though it's a topical analgesic or a topical anesthetic, and it's not. Benzocaine is, that you might find in some over-the-counter like numbing gels. That would be benzocaine, but aspirin doesn't work that way. So if you actually put aspirin on your gums, it will burn your gums. It's a chemical burn because the chemical name for aspirin is acetyl salicylic acid. It's an acid, it will burn you. Don't put that on your gums. If you want to take aspirin, swallow it. That's the way it's supposed to be made. It's supposed to be taken. Right, bad home remedy number 2. This is a peroxide mouthwash. Now, if you've actually been in my office the last couple weeks for an emergency, or actually the last day we were open, we were having everybody do this. We were actually having people rinse with a peroxide mouthwash, but it was a diluted 1% rinse. If you do that on occasion, it's not as bad, but if you do it routinely, it's not good. Some of you may have heard me refer to a peroxide mouthwash as the nuclear option, which it essentially is. Peroxide will kill off anything that's in your mouth. It'll kill off the bad bacteria, the good bacteria. It will kill off any white blood cells that have come out in your saliva that are protecting your gums. It can even just kind of injure the surface of the tissue of the gum tissue as well. If you dilute it and do it every once in a blue moon, it's not a major problem, but you really shouldn't do that on a regular basis. And you might see that recommended on the internet too, so I wouldn't recommend it though. An alcohol-free mouthwash or the warm saltwater rinse is a lot better way to go. Right, bad home remedy number 3 is clove oil. Sorry to tell you about this one, but the main ingredient in clove oil is eugenol, which actually has been shown over the centuries to have some benefits like antimicrobial, antiviral, antifungal benefits, and can dull pain. However, some research in the last several decades has shown that eugenol is actually damaging to human tissues, and at certain concentrations will damage tissues within minutes. Now, interestingly enough, the eugenol you can buy at the store or online is 100 times more concentrated than the tested levels that showed tissue damage. Now, if you wanted to use it, you could try that. You'd have to try to dilute it yourself, and actually there are instructions on most of these bottles to tell you to dilute it. Interestingly enough, there's also instructions on many of these bottles telling you it's not for internal use. So you can try to gamble and use it, but I would recommend not using clove oil. It's not really in your best interest to do that. If you have a toothache pain, I would take Advil or Tylenol, or I said the brand names, acetaminophen or ibuprofen. Hopefully I don't get in trouble for that. We'll find out if YouTube has a problem with that. I hope it wasn't too long and boring. I had a lot of information to get to you, and originally I thought about splitting this into 2 separate videos, but I wanted you guys to have all this information for those of you, we're all stuck at home, so it's helpful to know all that. If you found this information helpful, please hit that like button and subscribe. I'm going to be making videos in the future as well, and I'm thinking next week to have a video either on flossing technique or on helping you to prevent white spots around braces. So if you have a preference, let me know in the comments below. If you have other ideas for videos, let me know that too, and you can always make a note on our Facebook page. I'll be watching there. Good luck, everyone stay safe, make sure you wash your hands, and do the social distancing.